Hello everybody, welcome to my YouTube channel, Homeopathy Super Sessions by Dr. Jagos. Today we'll be doing the last part, that is the part 6 of Totality of Symptoms. Well, the point is selection of the potency. So potency is directly proportional to the susceptibility of the patient. So in my previous video, I have told you the susceptibility is done on the summation of 7 points. Then only you can have a better idea whether the susceptibility is high or whether susceptibility is low. You cannot judge the susceptibility on 1 or 2 points. So therefore, since it is directly proportional, since potency is directly proportional to the state of susceptibility, if the susceptibility is high, the potency given is high. If it is low, you give a low potency. Well, in cases also, if you are getting more qualified mental symptoms in the totality, then the potency selection will be high. Qualified mentals meaning what? A mental symptom having either an aggravating or an ameliorating modality. More characteristic physical general symptoms, potency selection will be from moderate to high. So you are getting more of physical general symptoms, then the potency selection will be from moderate to high. If you are getting characteristic symptoms, particular symptoms only, then the selection of the potency will be from low to moderate. Only pathology with common symptoms, then selection of potency will be low. Whereas if you have got characteristic symptoms on all the 3 planes, there is the mental plane, the physical gender plane, physical particular plane, then the selection potency will be high, provided no contraindication is there. So please remember that when we are judging the susceptibility, we are just getting a rough idea about the state of susceptibility, whether it is high or whether it is low. Depending upon the case, the potency has to be selected. Now, with reference to provided no contraindication is there, it means that special attention should be given to skin cases when in a skin case, you worked out the susceptibility, it is high. So therefore I said, if the susceptibility is high, you give a high potency. But remember, in skin cases, if you give a high potency right at the beginning, there's a fear of aggravation or an unnecessary aggravation may be precipitated. So in such instances, in skin cases where the susceptibility is high, it is better to give a moderate potency, because a too low potency or a too high potency, either way will cause an aggravation. So best stick to the middle path, give the moderate potency, that is the 200 potency. So that has to be remembered. Now, auxiliary line of treatment. Well, auxiliary meaning extra remedial. That means what? Besides giving the homeopathic remedy, what else can you do in order to give relief to the patient? That is known as the auxiliary line of treatment. So basically, it will depend upon the diagnosis. Based upon the diagnosis, there are different auxiliary measures. Now, as per Organon textbook, the auxiliary measures are given from FL number 286 to 291, in which electricity and galvanism is given in 286, magnetism 287, mesmerism 288, 289, massage 290, and baths of pure water at 291. So you have to read these aphorisms and you have to go into a little bit of details about each one of them. However, if we see the auxiliary line of treatment in the line of modern medicine, then it will depend upon the diagnosis of the disease. So say, for example, bronchial asthma. So besides giving the homeopathic remedy, what else will you do in order to get relief to the patient? That is the auxiliary line of treatment. So in bronchial asthma, you can have the auxiliary line of treatment of a spirometer. Tell the patient to blow and improve the lung capacity. Okay, so in this way, based upon the diagnosis, the auxiliary line of treatment will vary according to the light of modern medicine. But if we go according to Organon textbook, then Dr. Henneman has enumerated these 5 points. So if you want to know the details, please kindly see the aphorism. All the details are given there. Now, prophylactic measures. If the diagnosis of the disease points out to be measles, then the prophylactic remedy like morbillinum can be administered to other children living in the same vicinity as that of the patient. So, homeopathy can be used as a prophylactic. For example, if a child is suffering from measles, then the other children who are in the vicinity of that child, you can give morbillinum, and there's a possibility that they will not develop measles. So there are many remedies in homeopathy which may be used as a prophylactic measure. This is just one example. So from the diagnosis or from the totality of symptom, we can also identify the prophylactic measure. Well, advising correct diet and regimen. It will depend whether the disease is acute or chronic according to the totality. So our master, Dr. Henneman, in Organon textbook, he has given you the plan of the diet and regimen of an acute case and of a chronic case. So if the case is acute, then you can give anything in diet which the patient desires. So Dr. Henneman said that whatever the patient desires in an acute phase, you can give it to the patient, but he gives one caution word saying that provided it is within moderate bounds. That is very important. So in acute, you can give anything in the diet which the patient desires, as it will be a sort of a want from which the patient gets relief, provided it is within moderate bounds. So why will the patient ask for certain things? Because it gives him relief. That is why he desires certain things. For example, in a case of acute pharyngitis, suppose the patient desires cold water. And why does he desire cold water? Because the cold water relieves the pain in the throat. So Dr. Henneman warns you or tells you or cautions us saying that it should be within moderate bounds. That means what? He can have in a whole day maybe 1 or 2 glasses, but he cannot have 6, 7 glasses of cold water. So that is within moderate bounds. In regimen, the room temperature has to be adjusted according to the patient's need. Suppose the patient wants a warm room, he doesn't like the fan, you switch off the fan, or the patient is feeling very hot in spite of this pharyngitis or whatever the complaint is there. If he's feeling very hot, you can on the AC or you can on the fan. So the regimen or the room temperature has to be adjusted according to the need of the patient. He will want a certain regimen because he feels comfortable. So however, or in whatever way the patient is feeling comfortable, that way you have to provide it. That means in short, in acute disease, there is no restriction of food. You can give him anything what the patient desires because it gives relief to the patient. That is why the patient asks for certain things. But remember, it has to be within moderate bounds. Whereas in a chronic case, the diet and regimen has to be followed. So in aphorism number 261 with the footnote, long footnote is there in which dietary restrictions are given, like Chinese soup, herbal tea, or herbal soups, spices, condiments, all that are to be avoided. And in regimen, whatever wrong regimen the patient is following, that you have to rectify and you have to give a good regimen so that the patient is relieved from his sufferings. All the details can be obtained from aphorism 260 to 261 given in the 6th edition of Organon. So you can go through that if you want to see more details about the same. Well, that's all. So all these 6 parts, I finished up the totality of symptoms quite in detail. I hope it is useful to you, and I hope it has become clear to you regarding the totality of symptoms. Thank you very much.